And so we thought it was very important for us to discuss this because we have heard you, you've sent questions, and so we've got one of the best doctors to talk about it. All right? But before we get there, we'd like to know how your week has been so far. Since the last time we were here for AFYA Clinic, that was last week on Wednesday. So we'd like to know how your week has been so far. What are you thanking God for? Share with us through our social media pages. That is MBCI TV on Facebook, MBCI TV Official on YouTube, 0721 105 105 on WhatsApp, and of course 23814 SMS code, which is absolutely free of charge. So share with us and we'll be happy to hear from you. Now, today we are talking about issues of dentistry, mambo ya meno, yeah, and today we'll be focusing majorly on braces and root canal for two main reasons. We've had questions about braces, sana, but also questions about root canal, and so we'll be talking about that today. But also because we are in Nakuru, people have been saying unajua tuko na shida sana ya meno Nakuru, and so we said we'll have to tackle one by one. So be able to answer all the questions that you'll have on issues za meno. So as you continue, feel free to ask your questions. And today we have one of the best doctors from Nakuru Specialist. We'd like for you to know who Dr. Serah is. And for that, we've prepared a guest profile for you.
Good morning and welcome to AFYA Clinic. Joining us today through Nakuru Specialist Hospital, we are delighted to welcome Dr. Serah Ndaiga, a skilled dental surgeon and orthodontic practitioner. Dr. Serah brings extensive experience in dentistry with special expertise in orthodontics, cosmetic dentistry, oral and maxillofacial care, helping patients across all ages achieve healthier and more confident smiles. She also works with several dental settings in Nakuru town, where she provides comprehensive dental care and helps expand access to quality and oral health services. In addition to her clinical practice, Dr. Serah has been actively involved in community oral health initiatives, including public oral health education and screening activities in Nakuru County, efforts that help raise awareness and preventive care in the region. Please join me in welcoming Dr. Serah Wanjiru as she shares valuable insights on dental health, preventive care, and the importance of orthodontic treatment in improving quality of life. I'm your host, Rachel Kahogo.
And so we're here with Doc. Karibu sana.
Asante
How
sana.
are you doing?
I'm doing well.
It's
How
good
are
to
you?
see you? I'm well.
Thank
Good
you
to
for
see
having me.
Asante.
Yes.
You look amazing in scrubs.
Thank you. Asante sana.
Ona-
Pia wewe.
Asante.
Yes.
I had a photo in scrubs. We had that here later. I had a photo in scrubs, and so someone asked, Kahugu, unajua we need to agree if you're a doctor or not, because we can't fully trust you. But I like the idea of scrubs a bit too much. So maybe I'll study and be a doctor in future.
Yeah, you should.
Yeah. How are you?
I'm doing well.
It's good to
It's
see
a good
you.
morning. Thank you for having me.
Asante.
Yes.
For the people who are seeing you for the very first time, please introduce yourself and tell us where you're from.
So my name is Dr. Serah Ndaiga, and I'm a dental surgeon and an orthodontic practitioner.
Yeah.
And I've been in dentistry field for 10 years, over 10 years now. I have been practicing dentistry, and I'm very passionate about dentistry, all things oral health, especially giving beautiful smiles and also keeping people healthy with their teeth.
Yeah.
Yes.
Yeah. While you talk about the dentistry, I know it's very wide.
Yes.
And so be getting to talk about that. 10 years is a long time. What is your most unique experience in the 10 years?
Well, experiences are always different every day, and I cannot say I have one specific experience that has been very different.
Yeah.
But especially when I'm working with children and teenagers, I get to see how their life transforms, whether it's through their confidence, whether it's through just relieving their pain. I'm more passionate about treating children and adolescents, yes.
Okay,
Yes.
that's interesting.
Yes.
Now, today you're here from Nakuru Specialist. Tell us a bit about Nakuru Specialist.
Okay, so Nakuru Specialist is a level 5, both outpatient and inpatient clinic.
Yeah.
And we are running the dental department together with maxillofacial department with my colleagues. And the department has all procedures. We're starting from dental consultation to simple procedures like fillings, root canals, crowns, to even more complex procedures like implants and maxillofacial surgery, and including also daycare surgeries. For those children who can't cooperate with the procedures in the clinic, we do general anesthesia in theater and do all these procedures at once. So it's fully fledged hospital with fully fledged dental and maxillofacial, all the way from simple to more complex procedures. Yes.
Okay. While we were planning for this show, niliambiwa there's inpatient for dental patients.
Yes.
And I didn't know that.
Yes.
And I was wondering, where would I be admitted kwa sababu niko na shida ya meno, really? So take us through the people who would come for inpatient in the dental department.
Yes. So dentistry is wide, as you have said, and so some people will just come in for a consultation and a dental extraction and they go home. But then there are complex procedures. For example, you'll find a 3-year-old who has multiple cavities. Obviously, you cannot put that baby on the chair. The cooperation is a problem. The procedure is long. And so for such, we normally take them to theater. We do general anesthesia under the anesthesiologist or the anesthetist who is supposed to be monitoring the breathing and the heart. And then as we concentrate on treating the teeth. So that was one of the cases. More complex procedures for maxillofacial, people who have fractures of the face and the jaws, those ones will need to come for inpatient procedures. Yes.
Okay. Interesting. We'll talk about that in depth.
Yes.
But today we're focusing on braces and root canals. So I've had myself a root canal procedure and was treated by Her Excellency. Thank you very much.
You're welcome.
That tells you we are having a very good doctor here. But let's start with the braces. We've had very many questions around braces. For the people who are probably hearing braces for the very first time, in layman's language, braces ni nini?
So braces ni small appliances that we put on teeth. I know most people have possibly seen people with some wires or some metallic looking things, and sometimes they have color. So those small appliances are put on teeth in combination with the wire and the elastic. The elastics are the rubbers now you see on top that are different colors, blue, yellow. These also said they're the ones that are holding the wire in place. And then Sasa, when we put the appliances in the mouth, they help to straighten the teeth. We put little force over time, and then those wires, they help to straighten the teeth, to put the teeth in correct position, to improve bite and also to improve smile. So braces see our rainbow. We put them so that the teeth can align, so that the person who is having them can have a proper bite and a proper smile, which is straight, and also for confidence, especially for adolescents and teenagers, as I told you.
And I love that you're talking about confidence, especially for the teenagers and the adolescents, because that's very key. That's very key. But maybe there's a question that people ask Sana about braces. Is it painful?
No. So when we are placing the metallic brackets on the teeth, it's not painful. It's a completely painless procedure. But now, remember we said we are putting a little bit of force on the teeth. So initially, maybe 1, 2, 3 days, when you have the braces, you might feel some pressure. It's not pain, but it's a bit of a discomfort because you have something new in the mouth and we put a bit of force. So before getting used to it, you might feel a bit of the pull and push, but there is absolutely no pain. Tukikwekea braces, you will be comfortable. People sleep actually. It's very painless.
Okay. Would you take us through the process of the alignment of the teeth once you have the braces on?
So once you have the braces on, so the small appliances that I'm saying we place, they're already pre-calibrated in a way that if I put it in particular position and then I put the wire, then the teeth start moving slowly. But this wire also has its elastic limit. So after a month or however much your doctor will give you, mostly is usually a month, then you need to go back, then we change the wire so that we add more force. So ni pole pole, tukiongeza force, meno ikisonga, alafu eventually now when the teeth have moved in proper position and you're biting well, then now you get a retainer at the end of treatment. Because I know some people ameenda wamewekewa braces and then after they remove the braces, they're like, my teeth are going back to the position they were. So if you didn't have a retainer, then that's what happened. The teeth will go back to how they were. So you have to get a retainer.
Okay.
Yes, to hold those teeth in place for a specific period of time. And then after that, now we can say we've completed the treatment for braces.
Okay,
yes.
okay. Do we have different kinds of braces?
Yes, we do. So the metal braces, I know these days there's also something called Invisalign. Although we are not doing that for now, what we're doing right now is braces and two types of braces. The metallic one and some are ceramic. So the metallic ones are the most common ones you will see. And then ceramics are more white, so they're more invisible. So for adults also get braces, by the way. So for adults who want to maybe not be very conspicuous, we can do ceramic braces, but normally mostly we do the metallic braces. But there's also something else that is coming up called Invisalign, where you don't have to wear the braces, but there's something we give you to wear so that the teeth can align, but we are not offering that for now. For now we are doing the conventional braces.
Okay. So for the two kinds of braces, the only difference is the visibility.
Yes, that is the only difference.
Okay.
Yes.
Okay, so it's for you to decide.
Yes. But also there's something else that I hear people call braces, but it's not braces. There are something called removable appliance. So you can have an appliance that you can wear at home and then remove. They still straighten the teeth. If it's a very minor discrepancy, we can use the wire, but mostly we do braces. Yes.
Okay. Is there any misconception that you've had about braces?
Yeah, the most one I've had is, I am old, I can't get braces. I am now 25. No, if
people say it's too late. Too late.
Yes. No, if you're 50, you can get braces. If you're 12 years, you can get braces. So it doesn't have an age limit. If you want to straighten your smile, if you want to have a better bite, then you can have braces at any age.
Okay. That's very interesting. And I'd like for us to look at the structure of the teeth. Najua kuna watu waliruka classes fulani high school. Premolar, molar, inatupita kidogo. So I'd like for us to look at the structure of the teeth. And then now we'll look at the root canal. So if you have any question about the braces, please feel free to ask. At some point, we'll be able to answer all your questions. But it's very important that we've laid foundation on what exactly braces are, the different kinds of braces that we've talked about, and what you need to know before going to get those braces. In fact, what do I need to know before getting braces? Is there anything we haven't talked about that I need to know before getting braces?
Yes, for sure. So when you first go in or come for a consultation, what we'll do, we have examined the mouth. You have to get braces after all your other issues are fixed. So if you have cavities, you have to do those. If you have a root canal, you have to fix that. So your mouth has to be absolutely clean, no cavities, no gum disease, before we can do braces. And then we normally do an x-ray just to confirm how the jaws are positioned, what is the state of your bone, because teeth are going to be moving in the bone. And then we also have to do some tests. They're not really tests, but there's some measurements to know how the braces will be put, to know how the teeth are gonna move. Sometimes for some people it may require extractions to create space for teeth to move. So there's quite a bit you need to know. So that's why it's not very nice to just be asking on the phone, can I get braces? And so itakuwa nini? No, you have to go for a full assessment. And some people, there are contraindication for braces. Like if you have jaw issues, you can't have braces. If you have cavities that have said, you can have braces.
Okay.
Yes.
When you talk about jaw issues, what are you talking about?
So if you have like something growing in your mandible or in your jaw, that is the lower jaw called the mandible. If you have like a tumor, if you have like an abscess, if you have an infection, yes, that one has to be sorted before you get braces.
Yeah. Sort of cavities to konje.
Kwanza mpix hizo alafu mkuje for braces. Yes.
All right. So it's a whole process.
It's a whole process.
Yeah.
And you have to make sure also you're being seen by a professional, because I've also seen braces that have not been properly placed, and people have had side effects to that. Like if your teeth move in a direction they're not supposed to move, then it affects your bite. It even affects your joint, because you have this joint, and this relies on how you're biting and how you're chewing. So if your teeth move incorrectly, it even affects your joint. So it's not something simple.
Okay.
Yeah.
Okay. I hear you. Now let's take a look at the structure of the teeth.
So, of course, most people will have 32. If you're an adult, children normally have 20. But you must know some people have extra teeth, and some people have missing teeth. Those are congenital issues that people are born with. So some people have 28 and others will have 32.
Okay.
So the front ones are called incisors, and then after that we go to the premolars. We normally have 2 premolars and then 3 molars.
Okay.
Yes. So the surfaces, as you can see, mostly the anterior teeth normally have like smooth surface. So even brushing is easier. It's very hard to find people having cavities on the front teeth. But now when you come to the back teeth, you have these fissures. They're called fissures and grooves on the molars. So usipo brush, ukikula mabiscuits zako nini zinabaki hapa juu, then unaenda unalala, bacteria are there, they're working on it, they're converting all those sugars into acid. That's what eats away your tooth and creates a cavity. So hizo meno za nyuma, you're supposed to make sure after you eat una brush vizuri, unatoa all that uchafu iko kwa katikati ya hizo fissures. So mostly people get cavities on these surfaces.
Okay.
Yeah, because that's where food will pack and load. Rarely on the front, rarely on the inside. But when you're brushing, you should still brush everywhere.
On the inside,
you still do the proper brushing on this side, circular motion, and then when you come here, you do back and forth so that you remove everything. And then on this aspect, you also do a circular motion. Then you repeat all the way.
Okay.
And see 30 minutes tafadhali ile ya yes, at least 1.5 minutes to 3 minutes for brushing. That will be adequate.
Okay.
Yes.
1 minute to
3 minutes.
To 3 minutes.
Yes.
Okay. Okay. Now I'd like for us to get this particular segment that allows us to know how to stay healthy. That is healthy living. So we get the segment healthy living, and then we'll be coming right back. As we come back, we'll be coming back to read your questions, but also get to talk about cavities, but mostly root canal. All right. So let's get healthy living.
Hello and welcome back to AFYA Clinic, the show that puts your health first. Today on Healthy Living, we are talking about something many people worry about but only few understand: dental care, specifically braces and root canal treatment. Now, when you hear words like braces or root canal, you might immediately think of pain or high costs. But the truth is, these treatments are not only safe, but they play a big role in improving our quality of life. Let's start with braces. Braces are orthodontic devices used to correct misaligned teeth and jaw problems. Many people think braces are only for children or teenagers, but that's not true. Adults can also get braces and achieve great results. Straight teeth are not just about a beautiful smile, they help with proper chewing, clear speech, and easy cleaning, which reduces the risk of tooth decay and gum disease. There are different types of braces available today, including metal braces, ceramic braces, clear aligners, making treatment more comfortable and discreet than ever before. A dentist or orthodontist will assess your teeth and recommend the best option for you. Now, let's talk about root canal treatment, one of the most misunderstood dental procedures. A root canal is done when the inside of a tooth becomes infected or damaged, often due to activities, cracks, or injury. Many people delay treatment because they fear pain, but modern root canal procedures are actually painless and relieving. The goal is to save the natural teeth, remove infection, and stop the pain. If left untreated, an infected tooth can lead to severe pain, swelling, abscesses, and even tooth loss. So, early treatment is key. After a root canal, the tooth is usually restored with a filling or a crown, allowing it to function normally again. So, good oral health is part of overall healthy living. Regular dental checkups, proper brushing and flossing, and seeking early treatment can save you time, money, and discomfort in the long run. Remember, your smile is an investment, not just in your appearance, but in your health. If you're considering braces or experiencing tooth pain, don't wait. Talk to your dentist and get professional advice. That's all for today's Healthy Living on AFYA Clinic. Join us next time as we continue bringing you expert tips for a healthier and a happy life. I am your host, Faith Poema.
So that's it on healthy living. How is that?
Yes.
Iko sawa?
Yes.
People should follow what you've said.
Yes.
Good, approved. So follow what you've said. So today we are talking about issues of your teeth, dentistry, mambo ya dental. And we're focusing mostly on braces and root canal. We've already talked about braces, but if you have any question, feel free to ask. As I said before, is that our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, or SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Now we've talked about braces, and Dr. Serah has told us that you can't have braces on if you have cavities. Why is that?
Well, so when you have braces, I've told you guys you have to put teeth, the appliances on teeth. I actually have an over here. Yeah. That can show you the appliances I'm saying we put on teeth. So these small appliances that you're putting on teeth, you can see, imagine I'm putting this one on a cavity. On someone who hasn't been brushing properly, because of course if you have a cavity means the brushing is also a problem. So if you have that, it makes it even harder to brush. So if you put braces on cavities, that it makes harder to brush, the cavities become bigger, and that causes even more problems. So you do not want to have now pain when you have braces. Yes.
Okay, so that means you can't treat a cavity when you have braces on.
You can. Now you have to go back and remove the bracket, and then, and it's a whole process of bonding it back and cementing it. Yes. So we prefer your teeth are clean. Some people wanakuja braces na tunawambia enda kwanza ubrush 1 month, alafu you come back. Let me see whether you can actually maintain your hair, your cleanliness, so that we can do braces, so that the treatment doesn't fail, because it's also not cheap. So if you want to do braces, then you have to make sure you go through with the whole process and finish.
Okay, perfect. Now we'll be reading the questions that we have on braces as we continue, but I'd like for us to talk about root canal. And I understand root canal starts from cavities.
Yes.
You've mentioned that what work on a cavity, if you're brushing, is a problem. What? Guilty. Now, let's start with a cavity. What does a cavity look like, and what exactly is a cavity?
So, a cavity is a hole, on your tooth or in your tooth. So, what happens when you eat any sugar? And sugar sio sukari ile watu wanakoroga. Unajua nikisema sugar, people say, but I don't take sugar though. I quit sugar. Hapana, unakula ugali. That ugali is starch, so it goes into your mouth, it's converted to sugar. Unakula mchele, yes, that is sugar. So if you're eating any of those things, unakula sukari. So if you, normally your mouth has bacteria, some good, some not very good. So this bacteria, if you eat something sugary, the bacteria are there, they convert that sugar into an acid. If the sugar is lying in your mouth for too long. If you eat the sugar and brush, they do not have a chance. But if you keep the sugar on the tooth, then the bacteria ferments the sugar into an acid, and that acid is what eats away the tooth. So continually subjecting your tooth to sugar and acid make the cavity bigger and bigger until, so you have the structure of the tooth. The outer layer is enamel, the inner one is dentin, and then the inner one completely is the pulp, where you have the nerve and the blood vessel.
Yeah.
So if the cavity gets to where that nerve in the blood vessel is, then that's when you start having pain. That's why haulali usiku. That's why unakuja asubuhi kutuangalia pale Nakuru specialist at 7 a.m.
Yeah.
But this cavity has not started today. It didn't even start yesterday. It's probably some months. Yeah. So that's what causes the cavity, is continually exposing your teeth to sugar, not brushing properly, especially at night. If you do not brush, you're most likely going to get cavities. So when it gets to the pulp, now that's when we stay. We have to do a root canal. Root canal essentially means we go in to the pulp. I've told you how the structure is. We go into the pulp, we clean out the infection, because now the infection has usually reached the pulp. We clean out the infection, we disinfect the tooth, and then we fill the cavity. Yes.
Okay, you've mentioned about when it reaches the pulp. Why is it very painful? Those are the nerves, yeah?
Yeah.
Why is it very painful when it gets there, yet there are people who have cavities for, say, forever, like the kind of cavity that you just have feeling. Yeah. Or maybe let's explain it as, what's the difference between a tooth that you'd only need filling and a tooth that you need to do a root canal?
Okay. So if the cavity is confined to that dentine and enamel, haijaguza nerve at all, you might be feeling a bit of sensitivity on and off, kekunya majibaridi, evo. So that one will need a filling. So we just clean out the decayed part where it's brown or black. And then now we clean out the brown part and then we do a filling. Okay. So, but if it has gone now to the pulp, that's when the pain comes in. And the pain comes in where? When? Why? Because the infection has reached where the nerve is. Now the nerve is inflamed. You have even pus. Some people wanafura, because of the infection. So that's where the pain comes from. It's from the inflammation of the pulp. Okay. Kama hauna pain, then it's better you even come early, because it means the procedure is cheaper and even more faster, and before the pain comes, actually. Before pain comes, okay, realize you have something brown on your teeth or nini, you just come early so that we fix it before it gets to the painful state.
Okay. So would you advise for one to do a root canal or an extraction of a tooth that is very painful?
So I get these cases a lot. So when people come to see me, of course, they'll be like, imeno ni uchungu, daktari just remove. I do not want to see it. So, but I know what is making the person say that. It's about pain. So what I do most of the time is I will possibly give an injection to numb, because when you come, we numb your tooth. And then now I can ask you, what were you saying about the tooth? And then you realize most people will be like, can it be saved? So people do not want to remove teeth. What they want is to stop pain.
The pain,
So if the tooth is not so badly damaged, then we can do a root canal, stop pain, and you can have your tooth to continue eating with. And I recommend you save tooth so long as you can. If you can't save the tooth, do a root canal, do the crown, and let the tooth stay. It prevents... so, for example, if you remove this tooth, I think they are pulling out. So, if you remove this tooth, then this next one and this next one, they are free to move. So, you find that teeth start moving in whichever direction, and that affects how you bite. So, especially if you remove teeth, then you should be thinking about replacing. You should not stay without a tooth, especially if it's meno ya huku, katikati, any space that is there, the other teeth will start moving into that direction and trying to occupy that space. So if you can't save the tooth, save the tooth. If it's so damaged, we recommend extraction sometime, but that is like completely damaged.
Okay. At what point would you say a tooth is completely damaged?
If all this crown is eaten away, or maybe there's just a shell remaining, then I consider that completely broken down. Or even the whole crown is broken, it's just the root that is remaining. You know, ndani kuna root, so if only the root is remaining, then I consider that badly broken down. But even though you might see your tooth is very damaged, sometimes we still can save the tooth. We can do the root canal, we can do the crown. So most of the time, I can say most teeth can be saved.
Yes. I hear. At this point, I'd like for us to get the vox pops to hear what people say about root canal and extraction, and of course the braces. So we get that and then we'll be coming right back.
Kuna watu wanaweka braces kwa sababu ya jinsi meno yao yalivyomea kwenye magego, na yakimea visivyo huwa ndio sababu wanaweka hicho chuma ili kiyalainisha hayo meno. Na wengine wana sababu ya urembo na wengine wamekuwa na sababu zingine zisizo sawa.
Hiyo kuna mmoja niliulizia msichana, mwenye nilimuuliza alikuwa msichana, yeye akaniambia alikuwa na shida ya meno ilikuwa inatingika, lakini si wengi wanaweka kwa sababu ya umivu ya meno, wengine wanaweka kwa sababu ya rasao, na sabada mwingine ameng'oa meno ameweka silver juu ya raya sahi ya majensi, mnaelewa.
Hizo braces nadhani ni za kurainisha meno kama zimeacha gaps kwa meno mingi, wanaweka ndio ikuwe raini.
Hizo si inakuanga ni mapambo na maybe kuzuia gap ile mwanya, yani maybe mtu hataki hiyo mwanya yake ionekane hivyo. Hiyo ndio mimi naona ni maana yake.
All right, so that is what we have on the vox pop. So what would you say about that?
Yeah, I think wanaelewa nini inafanyika na braces, So kuna mwenye amesema hapo ni ya kuziba mwanya. Yes, braces, if you have your gap that you would like to close, pia braces zinafunga hiyo mwanya or any spaces in between the teeth. Yes, that can close. But since urembo peke yake, they always have a function.
Always katu decide unataka kuweka braces for no reason.
They always have a function. Yes.
Okay. Kuna mtu amesema nyinyi ma Gen Z, so there's the notion of braces near young people.
Yes.
But you mentioned earlier that whatever age it is, you can have your braces.
Yes.
Okay. Perfect. So I see we have questions coming in already. So we'll continue reading the questions as we go through our discussion. And we have one who's saying, hello AFYA Clinic, hello to you. So my husband akona growth kwa gum ya chini ya meno ya mbele. Ilianza kama gap kidogo tu kwa meno, then ikaanza kufura gum. Imekuwa ikioza polepole tu. Naenda hospitali. Okay, sijamaliza kusoma. But kwa sasa ni kama imefika mwisho na gap ni kama imetolewa meno moja. Juzi alienda hosi kwa meno hospitali, akatolewa kanyama hapo kidogo, ikapimwa, akaambiwa sio cancerous. Akapewa matibabu but haikuisha. Instead ni kama alipata infection because ilianza kumwaga I think damu mdomo yote. Finally alianza kubleed na hapo ndio uchungu iliisha hadi wa leo, but growth bado iko. Sasa anataka think aliende katolewa na haimuumi tena. Okay. Anasema anataka irudi normal, but mimi naogopa vile alipata shida juu ya kutolewa ile nyama kidogo juu ya testing. Si labda ndio atazidiwa aanze na uchungu tena na bleeding. Ama hiyo growth itakuwa ni kubwa sana. All right. So this is a whole explanation here. What I've gotten is the husband alikuwa na growth na ameenda hosi but akawa na infection. Vile amerudi hana uchungu tena but the growth is still there.
Okay. So I think I can get what they're talking about, because kama alikuwa na growth alafu ikaenda ikapimwa alafu ikasemekana is not cancerous, then it's a benign. So kuna cancerous na kuna benign. Benign means it's a growth that is not cancerous. So for a growth that is not cancerous, then you have to remove the entire thing. It's called excisional biopsy. Remove the entire growth. So that's what needs to be done.
Okay.
But you need to know, kama nilisema tu, you need to know that you're going to a professional and to a clinic that is licensed and registered also, because if you go to a place and they don't use maybe very sterile instrument and things like that, then you might get infection from that. So what I would advise ni akuje Akuja to Nakuru specialist, we have a look,
Yeah.
and then we normally do, nimesema we are doing from minor to major things.
Yeah.
Kama itakuwa something minor, we can do in the clinic. Kama itakuwa something major, we can do in theater, but
Yeah.
it doesn't matter. If you have a growth, then that need to be sorted.
Yeah.
Because there are also some growths that start at benign, but they go and progress to be cancerous. You do not want to ignore a growth in the mouth.
Yeah.
Also, maybe something else, because we haven't talked about the oral cancers. Oral cancers are also very prevalent this time.
Yeah.
Because of people, a lot of smoking now, and a lot of things like Mira, they are
Yeah.
predisposing people to cancers, including oral cancer. So cancer of the tongue, cancer of the lip, cancer of the mouth generally.
Yeah.
So if you have any swelling, then you need to sort it. Yes.
Okay.
Yeah.
Okay. Now, someone asking, what's the recovery process like after a root canal treatment?
Okay, so immediately after the root canal treatment, you're not supposed to have the pain you were having. Yeah, the pain you came with, you should not have such kind of pain.
Yeah.
But remember also, it's like you've cleaned a wound. Yeah. So you expect maybe to have a bit of discomfort for 1 or 2 days,
Yeah.
but nothing like the pain that you had. So if you have pain that you had after the root canal,
Yeah.
then there's a problem. So it's just a bit of discomfort for 1 or 2 days,
Yeah.
and then after that you should be fine.
Okay.
Yes.
Okay. Is there a specific sign or symptom that indicates someone needs a root canal?
Yes. So mostly the symptoms are severe pain, especially at night.
Yeah.
It's called nocturnal pain. So mostly severe pain, especially at night,
Yeah.
and deep cavities. That is what we normally use to say someone needs a root canal. But also, there's something else called necrosis. So your nerve, your pulp,
Yeah.
kama infection imekuwa mingi sana at once, the nerve may just die. So
Yeah.
you're not having any pain, but your cavity imefika kwa nerve.
Yeah.
So, but the pulp is necrotic, so you'll not be having pain. So, of course, people be like, but I don't have pain. Why do you want to do a root canal?
Yeah.
Because you need to remove that dead tissue inside and clean. Yeah. So most of the time is pain, but sometimes also without pain,
Yeah.
you may still need a root canal.
Okay.
Yeah.
Okay. Why is it that, especially for people with deep cavities, they have pain at night?
So pain at night mostly is because at night is when you lie down. So when you lie down, then the blood flow is going more to your. So when you're standing up, you see more blood flow is not going to your brain so much.
Yeah.
As much as you lie down, you have that blood flow flowing into your mouth, and
Yeah.
so more pressure with the blood on that tooth is what makes it more painful at night.
Okay.
Mostly it's just about at night you lie down. That is why people have more pain at night.
Okay.
Yeah.
I've been told I might need a root canal. What exactly happens during the procedure?
Okay, so when you come for a root canal, the first thing, of course, we've done the assessment.
Yeah.
The most important thing is you make sure the doctor is having X-rays as well, so that we can, the teeth. The root canal, yes, we are going to remove the nerve from the teeth, but
Yeah.
you need to make sure that the tooth is completely clean. So we do an X-ray just to see how many roots the tooth have, so that
Yeah.
we can make sure we clean. And then after we do the X-ray, we put the local anesthesia. That is what will numb your tooth.
Yeah.
Suchungu, by the way, a small prick.
Yeah.
So we put the local anesthesia, and then when you're numb, we put something called rubber dam just to cover the tooth and to isolate it.
Yeah.
And then now we open the tooth, usually with the bar handpiece, the rotating equipment that we do. Then we open the tooth, we clean the tooth, and then after we finish cleaning, we do the filling.
Okay.
Yeah. So mostly it's just that. So sometimes the appointment will be 2 or 3. Sometimes it will be a single appointment.
Yeah.
But that depends with as a case to case, yeah.
Okay, okay. Anasema, doctor, please, naweza pata permanent teeth tatu za mbele?
Yes. So permanent teeth, whatever we are recommending right now is called dental implants.
Yeah.
So dental implants are small devices that we put inside your bone.
Yeah.
They act like your root, and then on top of that we screw in a crown. Just looks like your crown that you had.
Yeah.
So they are permanent. and you can stay with them, for life.
Oh.
Yeah. So that's what I recommend.
Yeah.
Before we used to have some other things called bridges, but I do not recommend bridges. They have a very high failure rate. But for case to case, we can still do the bridge.
Okay.
So the bridge is it's like a bridge. So if you have maybe one missing tooth, we can use the neighboring teeth to create like 3 cups, so that we cement the cup on the 3 teeth, so that you have a replacement. So it's like a bridge, but the gold standard for replacing is implants.
Okay.
Yes.
Okay. So the implant, as you said, you can stay with it for life.
Yes.
Cleaning, the same.
Yes, cleaning, you brush normal, but you have to do maintenance. Of course, come to the dentist every twice a year to do cleaning.
Okay. Okay. In general, for the people who don't have any issue with their teeth, you know how we say that you should go to hospital to get the general checkup.
Yeah.
Do we have that for dental?
Yes, we do. Yes, we do. We recommend at least once a year. Mostly twice, at least have your teeth checked. If you have no issue, absolutely well and good. We tell you, ukasawa sana tuonane the next 6 months.
Yeah.
Yeah, because most dental issues start silently. That's why we advise you to come for checkup. Kila mtu afanye checkup. Ikifika January, kuja checkup, ujue meno yako iko sawa. Mid-year, do a checkup, ujue meno yako iko sawa, then you continue.
Yeah.
Because most dental issues start silently. Siku utaona uko na pain, hiyo issue imeenda sana, imekuwa for several months. So you can absolutely prevent so many issues by just coming to the dentist, having a checkup. Yes.
Okay. Okay. She's asking, how long will I need to wear braces, or does it depend on the age of the person?
Well, so mostly people will wear braces between 1 to 2 years.
Yeah.
That is mostly, but it also depends. It's case to case. So most cases that are simple alignment, it's just one crooked 2 teeth there, they'll wear braces maybe for a year and a half. More complex cases from 2 years.
Yeah.
Yeah, up to 2 years or even 2.5.
Yeah.
Yes.
Okay. Okay. So for these 2.5 years, because that's a really long time.
Yes.
What's happening over the 2 years?
Yes, so nimekwambia we have reviews every 4 weeks. There's a review every 1 month. There's a review. So, for example, you might be doing different things to the teeth. For example, the very severe cases where people have possibly their upper jaw is wider than the lower jaw.
Yeah.
So we are still also trying to balance the jaws. We are trying to align teeth.
Yeah.
If you have like some teeth that have been extracted to create space, then you need to close those spaces. So it's a small, the braces move the teeth slowly, not drastically. So you need time to move the teeth slowly so that you don't have side effects of moving the teeth so fast.
Yeah.
So in between hapa, tunaonana tu. Actually, ukikuja braces, just know you're going to be my friend.
Yeah.
Because every month uko hapo for the next year or for the next 2 years. So it's
you
a
don't have
relationship,
options. Yeah.
and you have to be committed. Yeah, it's a relationship, and you have to be committed because it's a process.
Okay,
Yes.
okay. So what happens if I have an issue with, or rather, I've been treated for a root canal, yeah? And then say I was supposed to have 2 or 3 appointments. And then after the first appointment, there's no pain, I'm not comfortable, and we don't have the second appointment. Is that a defect to that?
Yes, there's a problem because remember, if you come and we haven't finished the root canal, we possibly put a temporary filling, not a permanent filling. So at some point, that filling is gonna come out or fracture, and then you will get a reinfection of the cavity. Yeah, because bacteria that can still act. Hata kama nerve imetolewa, they can still eat away the dentin, so cavity itaendelea. So you need to make sure kama umeanza root canal, you have to finish.
Yeah.
Yeah.
Okay. Well noted. Serah, is there any way to prevent needing a root canal in the first place?
If you already have a cavity and it's small, iko kwa ile enamel na dentin tulisema, kuja haraka sana tufanye filling, you will prevent yourself from getting a root canal. Lakini kama uko na pain, most likely you will have to do the root canal.
Yeah.
Yeah. for us to be able to sort the pain.
Okay.
Yeah.
Okay. I still have very many questions around root canal today.
Yes.
And so after a root canal, will my tooth feel normal again, or is there a long-term effect?
Okay. So for root canals, what I insist is if a root canal is done properly, you're not supposed to have issues with pain again. It's supposed to sort your issue, and then when you do the filling, we align the filling in such a way that even though you're biting, you bite normal as you used to bite with the original tooth. So if the procedure is done well, you should bite well, you should continue eating, and you should not have pain. Yes.
Okay. So Doc, in general, how are you able to take care of your teeth? What are some of the things you're supposed to do to make sure that if your teeth are healthy, you don't get cavities? If they have cavities already, this could even worse.
So if your teeth are in good shape right now, then it means you've been doing something right. So there are several things. One, diet. The mouth by there is the gate to your body. So if you're eating well, your teeth will show as well. Because if you're not snacking here and there, if you've reduced the sugary drinks, that's the first thing. Diet. You have to make sure your diet is good. I do not recommend snacking so much in between, especially on sugary things. And then when you eat a balanced diet. It also helps you with your chewing and the jaws. And then after that, if you're eating well, the next thing is brushing. So brushing at least twice in the morning after breakfast, and then in the evening before you sleep. I recommend you floss. If you're able to floss every day, very nice. If you do twice a week, also okay, but brushing daily. Brush your tongue. People have a lot of bad breath coming from you're brushing your teeth, but your tongue. So brush your tongue, and then twice a year, come to the dentist. Going to the dentist is a must, because they'll be like, mimi sijawahi enda kwa dentist maisha yangu yote. Coming to the dentist is a good thing, so that nikwambie, this is what you can improve, this is what you can improve, and also at least get one cleaning at the dentist. Because as much as you might be cleaning, there are some areas you're not able to reach. So when you come for that once a year cleaning, then we can reach those areas. So basically, diet, cleaning, dentist. You'll be good.
For the kids, they're not able to brush very well. I assume. What would you tell the parents, or how the kids supposed to brush their teeth to make sure that it's still clean, especially that now that they take a lot of sugar?
So when the first tooth comes out, maybe at 5-6 months, you can get a piece of cloth. You do not have to get a brush then. Actually, get the brush later. If your child is 6 months to 2 years, you can just be getting a piece of cloth and you just wipe. Because what we need is just to remove the mechanically remove the dirt on top of the teeth. So you can do a cloth and wipe the teeth until they're around 2. When they are 2 now, you can get the brush. And I know it requires a lot of patience for the kids to brush, but brush them. Help them brush until they are 6. Don't leave 3-year-old with the brush. Yes, water chezanayo, and you see, but they will not be able to physically remove the dirt on the teeth. So we help them. When they are 6, then they start maturing, and we can teach them how to take care of their teeth. But I've seen very many children who do not have any single cavities. So kids is how you will bring them up. You show them this is a good thing, this is how you take care of your teeth. They will grow up with the same.
Sure thing. What causes bad breath?
Bad breath is called halitosis. So halitosis can be from 2 different places. So there is halitosis that is from the mouth. If you have like calculus, tartar, mananga, some people have like discolorations around the teeth. That's tartar. That's like uchafu yenye imeaccumulate over time. So that bad breath may be coming from there. If you have a cavity, food imekaa hapo ndani, imeferment hapo ndani, utakuwa na bad breath. So that's the breath that is coming from the mouth. If you're not brushing your tongue, mpaka huko nyuma, you might have bad breath. But it also, sometimes you might get people who have pulmonary issues or lung issues. So if you have bad breath and you've been treated at the dentist and you still have bad breath, then you need to get an assessment to check also your airway and your breathing. Yes.
Okay.
Yeah.
Okay, I hear you. But I love that you have really insisted on brushing and hygiene, because that is very important. And really that's the at least bare minimum you can do. Just make sure that you are clean, and not only for the dental, but in general. We talk about hygiene, and that's very important. Now we're going to take a very short break. So just to remind you is that today we are here for AFYA Clinic, and today we're talking about your teeth and the health of your, your dental in general. So what are you supposed to do to make sure that meno zako ziko sawa? And we have Dr. Serah from Nakuru Specialist, of course, right here in Nakuru. We'll be telling you more about the hospital. But for now, we'll be taking a very short break. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And my name is Rachel Kahugu. We'll be reading the feedbacks. Just to remind you, our numbers are very open. That is 0721-105-105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV. We're live on YouTube on MBCI TV Official. So we'll be taking a very short break. As we come back, we'll be coming back to read your questions and your feedback. Hopefully we've answered most of them. A very short break. We'll be coming right back.
MBCI Television, transforming lives.
There are many dead men walking. For you to be considered a living creature in the realm of God, he said you must have an experience of God. Faith is a dimension of dominion. Step out by faith. They continued in fasting. They continued in their walk of faith and righteousness until there was a visitation.
God allows to be in your life so that you can seek him.
Hello and praise the Lord. My name is Pastor Esarom Karajamangi, Senior Pastor, Kingdom Seekers Fellowship Thika Road and Kingdom Seekers Fellowship Kalatina. And I want to take this opportunity to welcome all of you into our Impartation and Dominion Conference 2026. We have our international guest from States, Reverend James McCoy, and then we have Apostle Michael Oropo from Nigeria. Then we have our spiritual authority, Apostle John Kimani William. We have Apostle Julia Subi and Apostle David Juma. Come and receive impartation for dominion during our times of worship and praises. Our team, Kingdom Seekers Fellowship Thika Road, will be leading us, and also we will be having Kingdom Seekers Fellowship Nakuru. The theme for our conference is from the book of Genesis chapter 1 verse 26 up to verse 28. And God said, let's create man in our image and likeness so that they have dominion. Dates for the meeting, 10th to 15th of February 2026. Time 9 a.m. up to 8 p.m. Venue for the meeting, Kingdom Seekers Fellowship, Thika Road. Don't miss. It is open to all, free of charge. Tell a friend to tell a friend. See you there. God bless you.
Advice yako kwa watu kutokana na kukunywa H2O sana, ni advice yako ni gani?
Shut up everybody. Listen.
Usikunywe kama unaendesha gari juu utaua wananchi.
So usikunywe H2O sana.
Sasa ukunywe juice cola, vitu kama hizo, masoda.
Nataka kupoesha chai, kwa kizungu unaweza sema aje?
I want to balance tea.
Yesu!
Tea balancing.
Unataka kuambia mtu kwa kizungu, nataka kupoesha chai. Nataka kupoesha chai. Utamwambia aje kwa kizungu?
Shut up everybody. Listen.
Namwambia palale lines. Tipalale line, tipalale line.
Nataka nikupoeshe chai, utaisemaje kwa Kizungu?
Tupoiri teti. Tupoiri teti.
Ninaamini kesho yetu imebarikiwa. Ninaamini kesho yetu si kama ya leo. Ninaamini kesho yetu itakuwa testimony kwa watu wengine, Bwana, katika jina la Yesu Kristo.
Aya, nikwambie kitu. Hata kama nimechoka. At least kuna kitu yenye inafanyika mzuri.
Bisi niambie venye na smile tu.
Sasa
God.
MBCI Television, transforming lives.
All right, we are back. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And today we are here for AFYA Clinic. As I said before, is that today we are talking about root canal, we're talking about braces and just how to make sure that your teeth are healthy. And we are here with Dr. Serah. Karibu sana.
Thank you.
We've had such an amazing time. That was very informative.
Thank you.
Already.
Thank you.
And so I'm encouraging you, if you've missed the first session, we've been live on Facebook and YouTube, still are. You can share the links with other people just to make sure that they know what they need to do, just to stay healthy. But one of my take homes would be, make sure that you brush your teeth. Nafanya hivyo vizuri. Because if you don't do that, then it means in the long run, you'll have a problem. But then you mentioned something and said, if you don't brush your teeth at night, hata kama ubrush asubuhi, it means that you'd think you brush, I'm a very healthy girl, or I'm a very healthy person, but then you're still having cavities and you're wondering what's happening.
Yes.
So make sure you brush at night.
Yeah.
You'll start trusting me as a doctor. Thank you very much. Doc, for the people who are just joining us, they're probably wondering Dr. Serah ni nani? Yeah. Please say hi to them once again and then tell us a bit about Nakuru Specialist.
Hi everyone, karibuni sana to MBCI.
Yeah.
And I am Dr. Serah Ndaiga, and I am a dental surgeon as well as orthodontic practitioner. And together with my colleagues, we run Nakuru Specialist Dental and Maxillofacial Department. So Nakuru Specialist iko pale Kiondo, Lanet, and it's a level 5. Has both outpatient and inpatient, and specifically we are running the outpatient dental clinic and the inpatient maxillofacial department. So karibuni sana for any of your dental services that you need, whether it's from consultation to any complex procedures like implants. Maybe to mention a little bit about the maxillofacial surgery that we are having. So if you have any injuries on the face, if you have any fractures of your jaw, if you have any swellings, if you have any tumors of the jaw, so you can come. And we are open to use the SHA insurance that the government is offering for inpatient and also outpatient dental for civil servants. We are using SHA, and for inpatient specifically for maxillofacial cases, for the fracture mandible, for any fractures of the face, for any tumors that people may have. You can come to Nakuru Specialist.
Okay.
Yes, we have specialists there, and we will take care of you. Yes.
All right. You've answered the question. You've not said your name, but you've asked, mnapatikana wapi wa mnatibu kila siku? Please answer that.
Yes. So we are in Kiondo. Nimesema tena pale Nakuru Specialist. You cannot miss it immediately after Shemeji. You turn on your left. And yes, tunafanya kazi from Monday 9 a.m. to 5 p.m. Monday to Friday, and then on Saturday we are working from 9 a.m. to 3 p.m. Yes.
All right. For gum operation, mnatumia SHA?
Kwa upande wa
gum operation?
Yes. So if it's an inpatient, we will use SHA. If it's outpatient, then we will use SHA, but specifically for civil servants and for TSC.
Okay.
Yes.
Okay. Great. So we'll be giving the contact as we wind up. I see that we have people asking about the contact. Do not worry. We'll make sure we give you the exact location and we give you the contact. You'll get all the help that you need. For now, I'd like for us to look at the myth busters. So these are some of the myths around, root canal and the braces. So let's take a look at the myth busters. So the first myth that we have is that braces are only for children and teenagers.
That is a myth.
Yeah.
You can have braces at any age. Yes.
Yeah. All right. The second one is that you can't play sports or instruments with braces. Is there any sports that you can't do because you have braces?
So we recommend, like for braces, you need to take care of them, because if you have any pores on the teeth or in the mouth, then you can have the brackets coming out or debonding.
Yeah.
So if you are actively playing a sport, we can give something called a mouth guard that you can wear during the sports, but braces cannot prevent you from playing sports.
Yeah.
We can prevent you from having injuries the same way any other person without braces can wear the mouth guard. We can still do that.
Okay.
Yeah.
The third one is that it's better to, the third one is that braces are extremely painful. Are they?
That is a myth. Yeah.
Never me insist, because people think it's extremely painful for you.
Braces are painless. Actually, people are shocked when we are just placing the brackets and they are even dozing off during the procedure. So they are painless. You will be fine. There is no pain.
Yeah. Okay. And the other one is that it's better to remove the tooth than get a root canal.
It's a myth as well.
Yeah.
If the tooth can be saved, please save the tooth.
Yeah.
The ones we recommend for removal, those are the badly broken ones. But so long as your tooth can be saved, please save the tooth.
Yeah.
To avoid many other issues.
Because then you'll have to replace it.
You have to replace it, yeah. So save what you have. And the best tooth is your tooth. The one God gave you, that one is the one you should try and live with. Yeah.
Okay. After a root canal, the tooth is completely weak.
No, that is not true. We restore the tooth, we put the filling, you're able to eat, you're able to eat with it. If the doctor has said the tooth is not strong, then you might need to do a crown, then you can just follow the step. But after the root canal, the tooth, you can still use it and it will be fine.
Okay.
Yes.
Okay. If the pain stops, you don't need treatment. Oh, ni Mkenya kweli kweli. They don't go to hospital without pain.
Please do not only wait for pain. Yeah, please, like, come early. Yeah, let's do the dental checkup early. Let's sort your issues early. You will have a very nice life.
Yeah. You don't have to wait for the pain.
Yeah.
So also you mentioned, if you wait for the pain, it means that it's far much gone.
Yes, it's far much gone.
Yeah.
The procedure is now much more complex and much more expensive.
Yeah.
Yes.
Okay. And the last one is that, the last one is that the tooth becomes completely dead and useless.
That is a myth. Yes, we remove the nerve, so the tooth doesn't have the sensation, but the tooth is still in your bone and it's very, very much useful. Yes.
Okay. Now, it's good that we've been able to debunk the myths, because that tells you that it is better for you to take care of your teeth. If you can, that particular tooth, take care of it before you have to, go for treatment when you can't even sleep because of the pain. So as early as you can, don't take chocolates, don't take biscuits, don't take a lot of sweets. Kidogo, moderation, daktari, si ndio? Si ati wache completely.
Kidogo na una brush.
Na una brush. Very important. All right. Anasema, good morning. Good morning too. Anasema ile meno imefanywa root canal alafu itoke ibaki root peke yake, lazima itolewe ama kuna another way?
Okay, I get that a lot because obviously kama ilikuwa imefanywa root canal you might not have pain, but Please, if the tooth is there and it's a root and imebaki hapo na iko open, there's a possibility of reinfection. Meaning bacteria zinaweza kuja bado na zingie kwa ile root na zikose infection. So kama uko na meno imevunjika, it has to be removed. The best way to remove it so that you don't have reinfection. Yes.
Okay. She's asking, where is Nakuru Specialist located in Nakuru, and which days are the dental clinics running? I think we've answered the question.
Yeah, we have.
But you can just take her through.
Yes, so we are in Lanet, Kyondo. Immediately after Shemeji, you will turn left, you will see Nakuru Specialist. We are level 5. And the dental clinic outpatient is running from Monday to Saturday, but inpatient is full time. Yes.
Okay. So inpatient is
24 hours. Yes, 24 hours for inpatient. For outpatient is Monday to Saturday. Yes.
Right. Anasema, what modes of payments are there for dental treatments in Nakuru Specialist? Also, can I use SHA for dental treatments?
So we have the mode of payment. Of course, we have the cash payers, but then we have insurances. We have major corporate insurances are acceptable. SHA for civil servants and teachers are acceptable.
Okay.
Yeah. So most insurance, if you're corporate, you're covered. Most of them have dental cover. SHA for civil servants and teachers, yes.
Okay. Now, for this question, I think you'll need to explain a bit more. But she's asking, or he's asking, for the people who talk like Tata instead of Sasa, can they be helped via braces?
Well, that can be because of two issues. It could be if you have spacing in between the teeth, that can cause you not to speak properly. If you have something called a tongue tie, some people's tongue has a very, it's very attached to the floor of the mouth, so they cannot be able to move the tongue freely to be able to speak properly. So you either have that, or you have the tongue tie, or you have space in your teeth. Both of those issues can be sorted.
Okay.
Yes.
All right. Asema, what's the number one mistake that people make when their teeth, with their teeth, that leads to big problems later?
Not brushing. Not brushing at night especially. That one, big problem.
Okay. Now, for the people who are watching you today and they're wondering, I've had issues with my teeth for so long, but now I've had this conversation. What should I do going forward? What would you tell them?
So, if you have dental issues right now, the best thing you can do is come in for consultation. So when you come in for consultation, this is what we do. You explain to me or to us your problem, and then we will note down your problem, and then we can give you what we call a treatment plan. So if you have cavities, we'll give you a plan to do the fillings. If you have gum disease, we'll give you a plan to do cleaning. If you need replacement, we'll give you a plan to do implants or whatever replacement. So when you come, you tell us the problem, we explain to you the solutions that we have, and then we give you a plan so that also you don't feel overwhelmed, like I need to do all these things. Sometimes treatment might even take months, but it's patience. If you're committed, then we sort your issues. I've seen so many people do a complete treatment plan for even 6 months. And now they take care of their teeth and they do checkups every 6 months. And I am happy and they are happy.
I can imagine when a dentist says that you're doing a good job, then really you're doing a good job. You're doing a good job for real. All right, we have someone who's asking, good morning. Ile meno imefanywa root canal, and is there any other way for it to be removed, like medicine, that it can be put and then it comes out? But why would you need to remove a tooth with root canal?
I don't know if he's saying instead of root canal, if you can put some medication to avoid it.
Yes. Is there any other way rather than to be removed, like medicine, that can be put and then it comes out?
No, the tooth has to physically be removed from the jaw. Yes, there's nothing I can put there to dissolute the tooth. Not possible.
Also, you said it's not painful, because I'm assuming what he's thinking about is a pain.
Oh, it's a pain, So modern anesthesia is very good. The anesthesia that we are using right now, you will get numb, the procedure is painless. Even in root canal, even in extraction, you'll be comfortable.
All right.
Yeah.
All right. So, Doc, maybe before we go into more explanation about, Nakuru Specialist and what you offer, what would be your parting shot to the people who are listening today? Something about, dental in general.
So, if I was asked, what would you tell yourself? Like, what would you tell people who come to your clinic with all these issues? I would tell you, if you have a child, we start with, if you have a child, they are 2 years, they have their first tooth, bring them for dental checkup. If you're an adult now, you're 20, you're 50, you've never gone to the dentist, the first thing you need to do a dental checkup. So everyone should get a dental checkup. Kila mtu Nakuru, get a dental checkup, come to Nakuru Specialist, you can use insurance, you can use SHA for civil servant, kuja dental checkup. That's my number one. Number two, brushing, kila siku. Tunasema, una brush in the morning for your friends and your colleagues. Ya usiku ni yako. Hiyo ndo ya kuchunga meno yako. So, brush, especially at night, and visit the dentist once a year, mandatory.
Yes. Okay. You said when you have a kid, na ndio ametoa meno, the first tooth. Bring them for dental checkup. Why is that?
So, you need to know, you will be able to know so much about the first tooth. So, there's something called early childhood caries, where children below the age of 3 get generalized cavities. But those cavities start very mildly, like with just a white spot. So, if you bring your child at 1 year, I'll be able to pick that white spot and tell you, your child is likely to develop cavities, so let's do this, and give you advice on how to prevent that. Instead of coming 3 years later or 4 years later when they have full-blown caries. So, first dental appointment, first tooth, first dental appointment.
Very interesting. I love that with how we are right now with the hospitals, like Nakuru Specialist, we have everything you need for you to take care of your teeth at any age, or wherever you are right now. If you have issues with your teeth, ama meno zako ziko sawa kabisa, there's something to help everyone. And like Tambo, where the only option would be toa tu your meno, it's bad. So right now there's a solution for everyone, and so I'd encourage everyone to take charge of your health. I love to say that, take charge of your health. And so for the people who are asking, we have many questions about when the dental clinics are, about SHA, and any other payment method that people would use. So maybe take us through that.
So the dental clinic is open. We open every day from 9 to 5. From Monday to Friday, and then we open on Saturday from 9 to 3 p.m. But in case you have an emergency, you can come in anytime. In case you have an emergency, in case you've had an accident, in case you've been hit and your teeth have issues, or your jaws, you can come in anytime. And then for the payments, SHA is acceptable for civil servants, for outpatient. You can access dental services, all these things I'm saying, root canal, fillings, all that can be done using SHA for civil servants and teachers. And then we have SHA now for the general population. You can access inpatient dental services. In case you have any trauma, in case you have any jaw issues, you can access inpatient for anyone with SHA. And then we also do, of course, cash payments, and then other corporate insurances. Corporate insurances including things like Britam, CIC, Jubilee, Death Miss, Minet, all those corporate insurances. We accept almost all of them. And they usually cover for dental procedures, any of these dental procedures that I've been talking about. So almost everyone can be able to access dental care at this point. And
I love that you've mentioned everyone can receive dental care.
Yes.
So it's not the sick people or the people who have issues with their teeth.
Yes.
Is that come get your checkup.
Yes. Dental care includes dental checkup.
Yeah.
And wewe upange at the beginning of the year, I was encouraging people like, just set at the beginning of the year, we've just started the year, do your dental checkup now, and then do another one somewhere in the middle of the year, and then you'll be fine. If there are any issues, we can know early.
Yeah.
I know Kenyans, we normally have this another myth that, hey, niende hospitali alafu niambie niko na shida. What you need to know is that the checkup helps you to get these issues early.
Yeah.
And the earlier it is, the more treatable it is.
Yeah,
and easier.
yeah.
Yeah.
And cheaper.
And cheaper.
Yeah.
Yes.
Yes. All right. So that has been great. Thank you for taking us through that topic.
Yeah.
Has been very, very informative.
Thank you very much.
For the people who would like to reach out, are you guys on social media? Do you have a number that you'd like to share? If so, please go ahead.
Okay, so yes, we are on social media. We are on TikTok at Nakuru Specialist, Home of Surgery. We are on Facebook and Instagram as Nakuru Specialist. Follow our page. We always have our number that we can call, that we will show on the screen for our number that you can call for Nakuru Specialist. And you're welcome anytime.
All right.
Yes.
Perfect. So that has been great. Thank you so much once again. I'd like for us to get the Did You Know? Yes, the Did You Know. So once we get the Did You Know segment, we'll be able to come back, and when we come back, we'll share with you the numbers for Nakuru Specialist Hospital, and you'll be able to call them and get the help that you need. All right? So even as we get the Did You Know, today is on Wednesday, and what that means is that we'll be having our lunch hours, and our lunch hours will start from 12:30 to 2:30 p.m. Okay, so if you're around Nakuru, please feel free, visit us, and you'll be able to have a good time in the presence of God. If you're not around Nakuru, also make sure that you come, and while you come, you'll be able to, if you're not around Nakuru, we are on Facebook, we're on YouTube, we're on MBCI Radio, on MBCI TV. Please make sure that you reach us out. You'll be able to have a good time. We'll be sharing something on our social media pages as well for every event that we're having. So make sure that you follow us on all social media pages at MBCI TV so that you won't be left out for any conference that you're having or anything that we are doing. Also, we have very beautiful pens. So Kienda Nakuru Specialist, we have a gift. Ukienda pale, make sure that you get a pen for yourself. No wambi umetoka MBCI. Sawa sawa? You will get a pen. All right. The Did You Know segment. So the Did You Know segment. Did you know that teeth are the only part of your body that can't heal themselves? Is that true?
Yes. Those need, Yes, those need feelings.
So they can't heal
Cavities
themselves.
Need feelings. Yes.
Yeah. But while you talk about healing themselves, what does that look like?
Well, if you have, for example, an infection or a swelling somewhere, your body can fight that infection, and you can come back to normal. The wound over time can heal itself. But for cavities, you will have to fill that hole. You will have to cover that place where you have the cavity. So that's what it means by saying it can't heal itself. You can't wake up one day, you had a cavity, alafu kesho imejifunika na something.
So you have to go. You have to go to the hospital,
us.
really. All right, that is great. Now, thank you very much. We have an event that's happening in Thika right now, and so we'll be sharing the posters on your screen. So that is what is happening in Thika right now. So if you're around Thika, please make sure you go. Nairobi ni karibu sana na Thika. So kama uko pale, please make sure you go as well. The theme of the conference is Impartation for Domination Conference. Started on the 10th, hiyo ni jana, itakuwa pale mpaka 15th of February 2026 from 10 a.m. to 8 p.m. on a daily. So do not miss out. As you can see, we have very powerful guests who will be there. So make sure that you come. This has been brought to you by Kingdom Seekers Fellowship. So make sure you attend the meeting, and I know that you're going to get blessed. All right. So once again, asante sana. We still have questions of, where you can get Nakuru specialist. Today we've had Nakuru specialist on set, and that has been Dr. Serah. We've had such a good time talking about issues of dental.
Thank you.
And we've been able to, just know what you're supposed to do to make sure that you're healthy. And that has been really great and informative. Please make sure that you share the link with other people. We said that the reason why we have these conversations is for you, one, to have the knowledge, but for other people to have the knowledge as well. So how you're going to make sure that these other people understand what you're saying is share with them the links. We've been live on Facebook and YouTube, so you're able to share the links, and they will get to know what exactly to do or how exactly to stay fresh. I've loved what Doc has said, that you brush in the morning for your friends and your colleagues, at night you brush for yourself to make sure that uko sawa. Yeah, really, that's my take home. So make sure that you stay healthy. Okay. This has been AFYA Clinic on MBCI TV. Make sure that you visit Nakuru specialist, and you're going to get all the help that you need. Once again, asante sana, Doc.
Thank you so much.
Yes. My name is Rachel Kahugu. Tumemalizia hapo sasa. You'll be able to get the music. So if you have any song that you'd want us to play for you, make sure that you send through our social media pages and, of course, our WhatsApp number. All right? Until then, God bless you. God be with you. Do have an amazing rest of the day. Make sure that you come for our lunch hours, as we've told you. Make sure that you tune in for the conference, and I know that you are going to get blessed. My name is Rachel Kahugo on this particular show. I'll see you next week, same place, same time. Bye-bye.